What can exercise do for me if I have chronic pain? Welcome to my channel. My name is Chadwick Oliveira, and I am a doctor of physical therapy with McGuire Physical Therapy in Fresno, California. I'm a clinical instructor, and I have a practice based around helping those with chronic pain. I am a veteran, and I have a personal history of chronic pain and PTSD. Pain is an alarm system. Chronic pain is any pain that's lasted longer than 3 months for any reason. Pain is there to protect you. When you are experiencing chronic pain, it is being overprotective. One of the things that you can do to reduce your pain is to exercise. There are many benefits to exercise with regards to your health and your well-being. Exercise helps to reduce pain by stimulating the nervous system to release endorphins. Endorphins are chemicals that have very similar structure to some prescription medications that are designed to reduce pain. Exercise is different for everybody, and it comes in a variety of forms. The best exercise is the one that you'll do. So I encourage you to try a variety of exercise, whether it be yoga, weightlifting, swimming, cycling, or just taking a walk. Find the one that you enjoy the most and do that. The release of endorphins is a form of a reward system that's built in for when you do something enjoyable, exciting, or challenging. If you're new to exercise or haven't done it in a while, the good news is you do not have to run a marathon or sprint up a hill. All you need is approximately 20 to 30 minutes of exercise 3 to 4 days a week, and that is enough to stimulate your nervous system to produce more endorphins. The effects of these endorphins can last between 24 and 48 hours, depending on the intensity and the frequency of which you exercise. The effects of this are best when done frequently over a long period of time. When we practice things, we get good at doing those things, and we benefit from the natural processes that come with that. So for exercise, the more you exercise, the better and longer lasting the effects of endorphins will be. If you don't exercise very much, your effect is going to be shorter. So when you're getting started in the beginning, you can anticipate that the effect won't last as long as it would for somebody who exercises every day. Your frequency of exercise will depend on the intensity of the exercise. 20 to 30 minutes of walking is a low intensity, and you may be able to do that every day. But if you were to go for a run and you're just getting started, you need to be prepared for muscle soreness afterwards. That may take a day or two for you to fully recover. That response of muscle soreness is an adaptation to the intensity of the work. And that can improve if you kept the intensity the same for a long period of time. So if you go at a lesser intensity, you won't need so much time to recover in between sessions. Higher intensity exercise will result in a longer recovery period. More frequently you are able to do that same intensity, the easier it will get for you, and you'll be able to do it more frequently. Now, the longer that you are able to exercise, the more frequently you're able to exercise, the greater it will be for your endorphin response. Be patient though. If you're just getting started with exercise, it's very tempting to do the best you can, go as hard as you can. If you're a beginner in the beginning, on that first day, if you go as hard as you can, you will be sore the next day, and that can be discouraging, and that can actually set you back. I highly encourage you to start off slow and build the habit of exercise, build the routine of doing it daily if you can. If you can't, 3 to 4 times a week, start there and build yourself up to doing it daily. The brain does produce endorphins at other times other than exercise. It does it during times of excitement. That can include threat or dangerous situations or positive situations like sex. Endorphins are there to suppress pain or danger signals and make you feel good. With chronic pain, the alarm system is staying on. And because there is a perception of threat to keep the alarm system on, the brain withholds endorphins because it wants to protect you. So in order to kickstart those endorphins again, start off small with exercise. Start off in doing an activity that feels safe and is not intimidating. When you decide that you're ready to start exercising, the first step is going to be to plan out your week of exercise. Sit down and decide which days you're going to exercise and which days you're going to rest to recover. If you have this planned and built in, then you know what to expect throughout your week. Starting with 3 to 4 days a week at 20 to 30 minutes at a time is going to be a good place to start and is enough to have this effect. And it's a great short-term goal that you can have each week to plan 3 to 4 days a week at 20 to 30 minutes a day. Your long-term goal would be to do that for 4 weeks a month. Each week, you can modulate the intensity or the frequency of the exercise based off of how your body is responding to the exercise. If you're not experiencing a lot of muscle soreness, then maybe you increase the pace or the speed, or you can increase the frequency, or you can increase the duration. All of those are ways to modulate the intensity and push you forward towards your goal. With everything in life, there's a give and a take. The benefit is pain relief. However, the cost is your time and your effort. Initially, your body may respond with muscle soreness from the increased level of activity. And this can happen from a simple walk. If you're not used to walking, then you may experience muscle soreness simply from going on a walk. That's okay. The muscle soreness is not a sign that your pain is worsening, and it's not a sign that exercise makes your pain worse. This is why having a plan to recover along with your plan to exercise is a good idea. Recovery should include a good night's sleep, anywhere between 7 to 9 hours, staying hydrated, and eating a balanced diet. Just remember that higher intensities of activities will require longer bouts of recovery. I recently had an experience with a high amount of high intensity activity for myself. Click here to hear my experience hiking up Half Dome. If you found value in this video and want to support my work, then hit the like, share, and subscribe. If you have questions, you can leave them in the comments. If you want to learn more about chronic pain, you can click on these videos here, and I will see you in the next video.